Welcome back into Everyday Kentucky. We're here with Dr. Carter Cassidy, who is the new chair of orthopedic surgery here at UK. You were telling me you first got here in 2000, right?
2000.
And so how does a doctor feel? I mean, you obviously love what you do, but then you take on all this administrative responsibility as well.
Yeah, it's been an interesting balance. I love my craft and I love what I do, and taking care of patients is the basis of that, right? So I think as you go along in your career, you know, I've done everything from mopping the plaster off of the floor in the ER to running the department, and I just think that it's allowed me to be able to hopefully provide the vision, the guidance of how, you know, treat people like how I would like my family to be treated. I mean, hopefully I can use the example for the rest of my team.
Sure. In terms of that, it used to be that people didn't think you could go to an ortho unless you were like some sort of high-functioning athlete or anything, but we found out now that that's not the case. And we were talking just a moment ago, the outcomes are so much better.
Yeah, so much better. Yeah, no, you do not have to be just an athlete to go see an orthopedic surgeon. I mean, we take care of everything from tendonitis to knee replacements to spine surgery, which is what I do.
Right.
And just because you see an orthopedic surgeon doesn't mean you're going to have surgery. You know, much of the care that we provide is non-operative, you know, send you to physical therapy. Sometimes people want to come in and they just want to be fixed, but you know, we assess each situation. The outcomes, our technology is so much better nowadays. We have so many great tools. You still have to get the basics, you know, you got to make the right diagnosis, you got to listen to the patient. But if you do those things with the, you know, sort of the tools and the techniques that we have here, it usually leads to a good outcome.
I have no idea what the numbers are, but you guys take care of so many athletes. I'm talking about not only collegiate and high school athletes, I'm talking about weekend warriors and everything. What is your vision for what you hope this department becomes as you take over the reins?
Yeah, so I mean, my vision is that we have compassionate craftsmanship. I like that. We want to take care of people. We want to be good craftsmen, not in the surgery, but just in taking care of people. So my granddad was a general contractor, and he didn't make a lot of money because it took him so long to get things done, because it was, I mean, he made things bomb-proof. And so, you know, I just want to bring that sort of ethos to our department. I want us to be able to take care of as many folks as we can. As we get further along with, you know, consolidation, you know, with the purchases of King's Daughters and St. Clair's. I mean, I'm hoping that our orthopedic footprint will be larger, because there's a lot of people that I think would, you know, just don't have really great access to orthopedic care. And, you know, if we can provide that to the people of the Commonwealth, I mean, that's what we're here for.
And they certainly might get it if it wasn't such a challenge for them to travel long distances, either for the procedure or the follow-up therapy that's so important.
Absolutely. Yeah, I always tell people, you know, I have the hard part for one day when I do the surgery.
Right.
But they have the hard part for the next, you know, 3 months or 6 months. It takes both the patient and the doctor to sort of make a good outcome happen.
Dr. Cassidy, thanks so much. Congratulations on the promotions and much continued success. If you want to find out about what's going on over here at UK, all you have to do is go to ukhealthcare.com/ortho. Thanks again, Doc. We appreciate it. We'll see you next time here on Everyday Kentucky.